Hello, welcome to Cafdil Healthcare on Cafdil TV. You know how important our health matters are, and so it is also imperative that every week we come your way to discuss very compelling issues related to our health. Today we're going to talk about lower back pain, which of course every human being sometimes experiences, and related issues. My name is Kojo Arthur. Stay with me as we discuss this very important topic for us to know how we, go about our daily duties, sitting down, sleeping, and so forth. This and many more is what we're going to talk about today. I've been joined here by two professionals from Cape Coast Teaching Hospital in the person of Richard Mensah. Richard is a physiotherapist at Cape Coast Teaching Hospital. Rich, you are welcome.
Thank you, sir.
And also Theodora Sewa Boache Iyadom, also a physiotherapist at Cape Coast Teaching Hospital. So, lower back pain. When we talk about lower back pain, what is it? At which part of our back can you locate that lower back pain?
So at the back we have divisions. That is from the neck, that is the cervical region. We have the thoracic coming down to the lumbar and the sacral region.
Oh, it means our back is divided into four.
Yes, please.
Oh, okay.
But many a time they add the lumbar and the sacral together.
Okay.
So we have divisions, we have bones, we have ligament at the back. But this, when we talk about low back pain, we are talking about pain that is felt at your low back. That is, if I'm explaining for us to understand, reading down from your rib, coming down. But for us to perceive it and have a more understanding of it, let us use images so that we can get a better understanding of it.
All right.
So this is the division I'm talking about. So this is the cervical region, coming down to here. This is the thoracic, the lumbar region, and this is the sacral region. So when we talk about low back pain, it is pain that is felt at this region, coming down from here downwards. At times it can radiate down to your lower limbs, that is your legs, depending on what is causing the pain.
Okay.
So when we talk about low back pain, it is pain that is felt around this region, coming downwards.
Is it closer to the waist?
That is, yes, it all involves, the waist is around this area.
Okay.
So it can come down, radiate into your waist, radiate down to your lower limbs.
Okay. All right. So what are those green things that you see there?
These are discs. So let's go into the anatomy of the back. So with this we have the bones. Yeah. These are the bones. So there are discs in between. This serves as cushions and as shock absorbers, which are able to help you bend over. When you jump and you land, they cushion you up, so these two bones does not come against each other. So what we are seeing here is there's a bulging disc. The disc is what protruding. These are bones that are spared, that is overgrowth of bones at a certain region. And there's a narrowing of the disc. This can come about due to aging or our own activities. I can give an example as you have a shoe. The more you walk on the shoe, the sole of the shoe, there will be some decrease at the point in time. So it happens as such in the lumbar region or at the back, which can result in pain. So this is low back pain, pain felt around this region coming downwards. But these are some of the things that can bring out the pain.
Oh, okay. Okay. The bulging and
bulging of a disc, bone spurs, narrowing of the disc. What happens is that you can see these things. These are nerves coming out of the spine, giving supplies from here. It supplies your arm. That is why you can move your arm. You feel sensation in the arm. You come to the lumbar, the thoracic region. There are nerves that give supplies to your intestines. You come down here, there are nerves here that comes giving supplies to your legs. That is when there's some pain around this region, it can radiate down to your legs. So the nerve serves as electrical wires, bringing signals to the bones. That is why they're able to move. So I tell people that you don't see a skeleton moving. It is the muscles that moves the bones. The muscles can also be stimulated by the nerves.
Okay. All right. So now you made mention of the bulging disc, the spurs and the narrowed. What is the original shape of the disc?
The disc, we have at the point in that every region they have sizes. Yes, but it is small. As the name implies, a disc, CD, compact disc. So it's like a disc, a round something that serves as a cushion. A very soft. It's some way somehow very soft. Yeah, that gives you cushioning and as a shock absorber in the joint.
All right. Okay, so let's see what are some of the common causes of this back pain, low back pain, and how can they be differentiated?
So internally, there are things that can cause the pain. As we have talked about one or two things, we have the herniated disc. When the disc, this one, it slips backwards. So this is what I'm talking about, the nerves here. So it is pressing on the nerves. This one will give you pain. You see this image. And because it is pressing on this nerve, this pain will radiate down up to this level because there's a connection here. Then these three nerves come together to form the sciatic nerve. So when it impinges on the nerve here, the pain will be felt at the low back. Other times it comes down, radiating down up to this level. So this can be one of the causes of low back pain. One, a vertebral disc can, or a vertebral bone can also slip forward. You see, this one has slipped forward, and this one is left at this position. So this one also can cause pain at the low back. You see, this region is painted red. It means there will be pain here, because when this bone is pulling, some structures will be pulled along, which will cause tensions at the back, bringing pain.
Oh, okay. All right.
This is another cause, a broken bone at the lumbar region when there's fracture. So when there's fracture, the bone can impinge on the nerve here. Inflammation will take place here because the body is want to heal that wound that has been caused, which also brings pain.
All right. So now, this broken as a result of?
It can be trauma. Someone can be involved in an accident, or someone can fall from a height. It can also arise from maybe a disease, a bone disease. Some example is osteoporosis. That is when there are holes in your bones. So it can break easily. This can also bring about this. So we call it spondylolisthesis. That is when it's slipping.
Now, you go back to the second one. You said this one for slipping.
Yes.
What causes as a result of what?
It can be weakness from the ligaments. As I said, there are ligaments that will be holding the bones in their position. But when there's weakness, this one can shift forward. Or when you lift a heavy item with force, using your back or wrong posture, this can slip.
Like when you go to gym and you are lifting something.
When you are using awkward posture to lift a heavy weight, this can also happen.
Wow. All right. Then this
is an X-ray. So this is a normal, this one are just images, but this one is a normal X-ray from a human being. So comparatively, comparing this one to the one we saw, at the lumbar region, when you see this, there should be a curve here. This is how God created it. There's a normal curve that is called lumbar lordosis, lordotic curve. It can be excessive or it can be reduced. So when you come here, you see that the curve is reduced. The spaces here are reduced. It means that the disc is wearing off. So at this moment, these bones will be going against each other, which will be bringing pain. You see, there are a lot of osteophytes forming over here. That's the bone spares that we talked about in that image. So this one, you see, even compare the alignment here. This one is a bit shifted forward. So the alignment is not correct. So this can arise from bad posture and aging as well.
Bad posture?
Yes.
Whoa.
Bad posture. So coming down to the causes of low back pain, we have non-mechanical disease process. Something like kidney problem, prostate cancer can result in back pain. Improper way of lifting. When you bend over to lift, you are lifting with your back, which can bring about pain. Poor posture, as we talked about. Prolonged sitting can bring about back pain. And degenerative conditions like aging. And this one, trauma, an accident or falling from an height, and frequent bending over, especially when we are using our phone. You see people bend over looking onto their phone several hours. This can also bring about pain.
Already when you are sitting there, you are sitting in a bad position again, using the phone, bending
over. So you have distorted your posture. And you do this for hours and days, years. Initially, you may not feel anything because maybe your body can resist the shocks that are coming into your body. But as you get older, or as the strength of your body reduces, then the pain started emerging.
So how long does it take for you to see all this kind of thing?
It depends on what happens in the person's body and the structure of that person's body and the shots it can take. Someone can do something now and start feeling the pain. Someone will have all these things we are talking about. This can slip but will not have any pain. Someone can have all these degenerative conditions appearing in the bone. You take an x-ray, you see all this deformity, but there's no pain. Someone will not have a correct back posture on an x-ray, no degenerative conditions or degenerative seen in the bones, but there will be pain. Okay. So depending on what the patient will present, the activities that are done by the patient and what the patient will bring.
Your first picture, very first picture that's, no, go back, this one.
Yes.
You made mention of, as a result of that lower back pain, that person experienced pain downwards.
Downwards, yes,
isn't
please.
It?
Yes.
I want to ask, if you have also a pain at your ankle or something like that, does it also affect the lower back pain?
No. Having pain at the ankle in the long run can also affect your low back because one, when you are feeling pain at your ankle, you may be tempted to walk in an awkward way, limping, distorting your posture. So when it continues for long, you have distorted your back posture, which can also bring about pain at the low back.
Oh, okay. Yeah, I get it. Let me bring in Theodora. What is the difference between the acute back pain and the chronic low back pain?
Okay, so before I get to the difference between, with the causes, there was one or two things we can add. Pregnancy. Pregnancy is also another cause of low back pain. You see, when a woman is pregnant, the stomach bulges out, not the stomach, I mean the abdomen bulges out, and the woman tends to bend like this. So it gives them low back pain. And also another cause is obesity. When a person does not take care of the weight and the person keeps on increasing the weight, it puts pressure at the low back, leading to low back pain. So now, moving on to your question. You said what's the difference between acute and what?
Chronic.
So acute low back pain, when we say acute, it happens within few days. Let's say within a day to 7 days, you started feeling the pain at your low back within those days. And chronic is like it's been weeks. It's been some weeks up to some months. That's what we term as chronic low back pain.
The one that comes
it's
gradually.
persistent.
Okay, persistent.
Sometimes it can be intermittent. It's on and off. Maybe when the person wakes up in the morning, that's when the person feels the pain. But during the course of the day, the pain is down. Each individual is different and experiences different causes of the.
All right, you are still watching Cafdil Healthcare here on Cafdil Television, and we are discussing lower back pain. And you've seen a lot of the pictures, and I mean the images, how it's the causes of all those pains. And I am very sure that we are learning a lot from this, and henceforth our postures is going to change, so we can avoid these pains and so forth. So you made mention of poor posture and so forth. I want to know, how can that contribute to low back pain, and what are some of the strategies to improve posture?
Okay. With back pain or low back pain, as we talk about, because it involves the spine, and your spine is one particular portion of your body that you use much without you even knowing. So this is your spine. When you stand, you use your spine. When you sit, you use your spine. So in most of your activities, you are using your spine without knowing. So it is better for you to use a word to assume a good posture. So one, let's see, when you stand, your ear and your shoulder should be aligned.
Your ear
and your shoulder
should be aligned.
And from your shoulder, your wrist down to your knee and your ankle, they should also be aligned. So you don't stand and poach your back in like this, nor put up your chest like this. Yes, because there's a natural or neutral posture God created the spine to be. So in any posture you assume, it's either you are maintaining a neutral or a good posture, or you are distorting the posture. And whatever you are doing per time, repeatedly, as years has gone by, you do it, then you are when you are assuming bad posture, you are distorting the posture, your spine, without knowing. So I don't know if I brought this, you see, yes. So when your chest comes out this way, there's a normal posture for the chest. There should be a lordotic curve here, but when you exceedingly come in, there's excessive or lordotic curve, which means you have distorted that posture. When you push your back like this, the back coming out is called kyphosis. So excessive kyphosis also distort the posture, distort your spine or forward head. That's why I say your ear should align with your shoulder. So when you assume any of these postures for a long period of time, you have distorted the posture. You assume a bad posture, and for years, as you continue to do it, one, you are weakening the muscles, because one, when you do this muscles has been stretched. The other one, the back, has been contracted. So when you assume this posture for a long time, it will stay with you. When you push your back like this, years to come, you have contracted these muscles, you have extended these ones. So years to come, it will be stuck, and which is not a good posture.
This is the kyphosis.
This is the kyphosis. And this is what? Forward head. You see people rounding their chest like this, and their heads are forward. That's how they walk. And because the spine has a neutral posture that it has to assume. Typical example is lifting something from the floor. We saw something in this image. See someone bending over like this. When you bend, you have used a bad posture. Now you are lifting with your back. So all the strength, you are not using your hand, you are using your back to lift. And let's consider this as 50 kg or even 20 kg. And you are lifting this with your back. And it will not be once. You do it once, twice, thrice, all this time. Maybe your work involved lifting, and you always do this thing. You are putting pressure at your back. At a point in time, the muscles that will give in, the ligament that will be weakened, and it will result. It can result to a disc slip, as we saw. It can also result in bone spurs growing at your back, and this can also result in weakness in the ligament and the muscle, or the muscle can be tensed, bringing about what? Pain. When we sleep, when we don't assume good posture, this one it's a sitting posture. Whenever you are sitting, talking about taking good posture for your back to be aligned, we call something 90-90. So from your head down to your waist should be 90 degrees. From your hip down to your knees, 90 degrees. And your knees down to your foot and your foot on the floor should be 90 degrees. That is the good posture in sitting. When you lie, many a times we sleep in awkward postures because we don't see what happens when we sleep. But in sleeping, there are good postures to sleep. If you start assuming such postures, you get acquainted with it. And before you go to sleep, you assume such posture. Although when you sleep, you don't know what happens. But if you continue to do that, you are what? Assuming good posture. You will sleep well and wake up well without feeling any pain.
All right. Okay. That is good to hear. So you stand with that is the spinal cord.
This is not the cord. This is the spinal region. These are bones. The cord is inside. It's like a strange.
That's the small ones that you can see here. In between that.
It runs through this area, coming downwards.
Oh, okay.
And the outlet here that comes out, giving supplies.
All right. In everything, our lifestyle also counts a lot, isn't it?
Yes.
So let me come to you, Theo. What role do lifestyle factors such as diet and exercises, what role does it play in managing or preventing low back pain?
Okay. So let's use two people for an example. There's this, let's say person A is a person who doesn't take care of his or her diet. He eats anyhow. He eats any kinds of food, all kinds of junk foods. And this person B is very cautious about his or her diet. So with these two people, person B is going to have good blood supply, good muscles, good bones. He's going to have all the nutrients good for the bones and good for healthy living, whilst person A is also going to lack all these things. The person is going to have weak muscles, weak bones. So comparing these two, a person with a stronger muscle or stronger bone is going to be less at risk of low back pain as compared to person A, who doesn't take care of his or her diet. Same with exercise too. So if a person is there, you do not do any exercise at all, you just get up and go, sedentary lifestyle, it's going to weaken your muscles and also your bones, the density of your bones is going to reduce them. But when person B exercises a lot, it strengthens the person's muscles and also increases the bone density, giving the person a higher chance of not getting low back pain. But the person who do not take care of the diet or do not exercise, the person is more prone to getting low back pain as compared to.
You made mention of a person A eating anyhow junk food and stuff. So what are some of the things that you think it's advisable to eat in order to prevent all those things?
Okay, so the little I've learned from the dietitians is avoiding more greasy food like deep fried foods. Fried yam, plantain chips, oily foods. They increase inflammation and stuff, and they reduce your immune system as compared to fruits and vegetables, raw vegetables, and eating less cooked meals. So like this generation, we like to eat more of the Indomie, stir-fried, French fries,
the Gen
pizza,
Z
the Gen Z generation.
The Gen Zs.
Yes, as compared to the more local plantain with contour stew, which more nourishes the body as compared to these junk foods. Yeah.
All right. Rich, she made mention of exercises and stuff. Are there specific exercises or stretch that are particularly effective for alleviating low back pain?
Yes, there are a lot of exercises you can do to curb your back pain, but it is tailored according to the symptoms you are showing or the signs you are bringing up. So, but there are general exercises you can do. So we can look at this image. We have the bird dog exercise. You can also call it cat and camel. You bend over like this with your hand on the floor, your knees, then you push your back upwards.
Okay.
Upwards, you count for maybe 5 seconds. Yes. 5 seconds. Then you bring it down slowly downwards.
Okay. Okay. I get it.
This one is a thoracic extension stretch. You need a roll here, which is somehow not common in Ghana, but you can get some nowadays because of this home use goods. You can have some. You do your stretches over it.
How does it look like?
It's round. Yeah.
Long.
Long.
It's not. I thought when I saw it, I thought it was a ball.
It's not a
football.
ball. But you can also use ball.
Football.
Yes. You can use ball.
How long must it be at the back? How long should you stretch like this?
You stretch this. You count 10 seconds. You relax. You do it again. You can do 3 sets.
Okay.
In the morning and evening.
All right.
And another example. This is another stretch in this same position, but you stretch your left leg and the opposite hand.
Right hand.
Right hand.
If it is left
hand,
right
leg.
Oh, okay.
You hold it for 5 or more seconds. Then this one is standing ham stretch. You are stretching your hamstrings. There are so many things we can talk about, but sometimes due to our time, when the hamstrings are tight, it can bring low back pain. When you have low back pain, it can make your hamstrings tight. So you need to stretch them. So one way you can stretch them is bending over, holding your toes on the floor. You count 5 or 10 seconds, 3 sets. And back extension, some people call it what name? I've forgotten the name. Back extension is that you lie on your tummy, keep your hand on the floor, and you raise your upper back up.
Like doing a press up.
Yeah, we call it cobra stretch.
Cobra stretch.
Cobra stretch. So you lie on your tummy, you keep your hand on the bed, then you bring the upper back up and your head's up. You can hold it 5 or 10 seconds. You relax slowly. You can do it 5 sets. And this one, knee to chest. You lie flat in supine position and you bring your knee towards your chest. You hold it and count 5 or 10 seconds. You relax it.
And you do on the opposite side?
Opposite sides. And we have swimming. Swimming is a very good exercise, but people don't know.
Some of us are afraid of water. I'm telling you.
So you can get an instructor who can take you through the swimming because it's a very good, it's an aerobic exercise as well. But in all this, it will be better for a professional to assess you, because when I'm talking about stretching your hamstring or maybe moving your knee to your chest, someone will do this and feel pain, and the pain will increase. There are some people, due to what is causing the back pain, the low back pain, when they flex the back, it brings more pain. But when they extend it, it releases the pain. Others, when they extend, they feel more pain, but when they flex the spine, the pain reduces. So it will be better for a professional to assess you and prescribe particular exercises for you.
Sorry.
So these are also other exercise, back arch, but we can call it bridging exercise. There are other factors we didn't talk about. When your abdominal muscles are weak, this can also bring back low back pain, because the abdominal muscles work hand in hand with the back muscles. So if this portion are weak, the muscles here are weak, they can bring back pain. So you need to strengthen your abdominal muscles doing planks. You hold this posture, you can count 10 or more depending on your strength. This is bridging exercise.
I remember I did this, and hey, in counting 30, the machine gave me 30. I started shaking.
Yeah.
I started shaking. I say now was so started heavy.
So
it's not easy exercise.
It's not easy.
Yeah, it's not easy.
But you build capacity as you continue to do it. You can start from 5 seconds, the next day you move to 10 seconds, then you progress. Exercise needs to be progressive. So we've talked about swimming, bed and dog. We talk about it on the other image. Now this is table or chart poses. This also stretches your back. You keep your arm on the floor, you knee down, and you stretch like you are sitting on your heel. So you stretch your back. When the muscles are tight, you stretch them out, they are relaxed and the pain releases.
We have a lot of apps that teaches that, and at the end of all those exercises, you are asked to stretch in that manner, which is not easy.
Yes, stretching is very, very important, but people don't. Yes, we talk about exercise. Before you exercise, you need to warm up. After exercise, you warm down and you stretch. You need to do stretches because you engage the muscles, which some of them may be tight and tensed. So after the exercise, what do? You have to stretch and relax them, getting them back into their normal posture, their normal state.
And what is it? Mackenzie prone press up exercise?
Yes, wow. This is a type of exercise you can do to release your back pain. The cobra stretch we talked about. So this is the procedure. You lie down, keep your palms on the floor, then you bring your head and your upper back up. You see, this lady has stretched more than this.
Yes.
So depending on what you can do.
Oh, okay. So when you made mention of you seek professional advice and stuff, let me ask, when should someone seek those professional medical help for low back pain, and what type of specialists are involved in treatment?
I think as early as possible. One, you need to move to the hospital. Especially pain that you started feeling it, you've taken some medication, but the symptoms still persist. You have to move to the hospital. One, there are so many factors that can bring about the low back pain. What if there's an organ involvement? Maybe there's a kidney problem that is causing that. If you hold on to it at a point in time, when it gets to the end stage, it is not treatable. So the earlier, the better. And even normal low back pain, without any organ involvement, in anything, the earlier you treat it, the better. So as you move, the person will assess, know whatever is causing the pain. There are sometimes the patient just need advice concerning his or her work, his or her activities in the house. Then the pain will come down. Someone will be taking medication, but still doing what is causing the pain, and will be complaining that I've been taking this medication for all this while, but I've seen no changes, because you don't know what is causing your pain. Maybe your sitting position, maybe even the mattress you are sleeping on is not good for you. Maybe your work activities, what you do, your posture you assume at your house, at the workplace is not good for you. You just need a professional advice that will help you to adjust yourself so that the pains will calm down. And the professionals involved, a medical practitioner can be involved, and a physiotherapist.
Like yourself?
Yes, please.
All right, you're still watching Cafdil Healthcare here on Cafdil TV, and this is what we discuss. I know you are learning a lot, and henceforth, like I said, your posture will change. How you sleep hard, the way you sit, the way you stand, and so forth, it's going to change, and you are not going to feel, and even more importantly, the exercise that you should be, your routine exercise that we should be doing. I've learned a lot from this, and from now on, I'm going to continue my exercise. When I do some exercise and it's so difficult, I don't want to venture again. But I think consistently, I'm not going to feel that pain. And likewise, yourself. And let me bring in Theo. You are relaxed because I keep, when you said 1990, I keep on watching you how you sit and stuff.
Okay.
And if you see 1, 2, then I will also adjust myself and stuff. So, what does stress, I'm talking about stress, impact low back pain, and are there any technique for managing stress that can also help with back pain?
Okay. So stress is a bad thing. It doesn't help any health condition, and so it doesn't help low back pain as well, because when a person is stressed, the person releases a hormone called cortisol a lot. And when these hormones are
called what?
Cortisol.
Okay.
Yes. If cortisol is in excess in the body, it doesn't help the muscles, it doesn't help the bones as well. And another cause is when a person is stressed, the person does not take care of the person's posture. Because when I'm depressed, I'll sit there in a slouched posture, thinking, maybe I'm thinking about different things. All the time, I'll keep to myself. So you'll be assuming poor posture. So these two are the major causes of, or how stress has impact on low back pain, or how stress causes low back pain. So you asked about how to manage stress. As human beings, in this world or in this Ghana that we find ourselves, we cannot do away with stress. Like, it has become a part of us. You go to work, there's stress. At home, there's stress. Finances, there's stress. But then you have to be able to manage it. Because you are there, you shouldn't sit down for it to kill us. So you have to be able to manage it. So one way we can manage it is deep or breathing exercises. So as we are walking, we are breathing normal. But then when we breathe deeply enough, when we inhale more air into our lungs, it takes more oxygen into our lungs and therefore more oxygen into the various organs of our body and our muscles as well. So it helps manage stress. It helps curb down the level of cortisol in our body. Apart from deep breathing exercises, how to manage stress, another way to manage stress is exercise. As we exercise daily, exercise produces these happy hormones in our body. An example is serotonin or dopamine. So as we exercise regularly, these happy hormones will be increased, whilst the bad hormone, which is the cortisol, will be decreased. So these are the ways that we can manage stress. Also, our diet also has a role to play when it comes to stress. A person who doesn't eat well is more prone to stress than a person who eats well, because bad diet will be producing a whole lot of bad hormones or bad chemicals in the body. That's going to bring the body or bring the immune system down, whilst a healthy diet will do otherwise. So that's the way we can manage stress.
Right. What do you want to add?
Yeah, let me make an input on this. I think swimming, as we spoke about, is also very good. It relaxes your muscles and it brings you a feel good, which increases the feel good hormones in your body to be released, which makes you relax. And if there are any stresses, it comes down. There are so many activities you can do. You can have a nice time with your wife if you are married, your family.
Have what?
A nice time, like going out.
Nice time. Okay.
When you are stressed out. That's why weekends as workers, you must make time with your family, going out, maybe having a lunch together somewhere. It brings your stress down.
All right.
Exercises, as you talked about, walking, just normal walking. You can have a group exercise in your home with your own family.
Yeah, sure.
You don't need a gym before you exercise. Even in your own house, you can just be playing with your kids, moving, walking down
dancing.
And doing hide and seek, dancing. Yes. So it all helps.
With this, do we even have any misconception about low back pain that you may want to debunk or something?
I think you earlier touched on that. Initially, people thought that low back pain is for adults. But it's not only for adults. Depending on the activities you are doing, and I can say that about 90% of human beings at a point in time experience low back pain. So it's not only for adults, although it happens to, or it affects adults the more, but at any age. One typical example we have seen with children now going to school, with our little knowledge of what we've seen at the workplaces, the kind of bags or books they carry in their bags is distorting their posture. You take an x-ray, that you know that a child's spine should be as straight as this. The curvature you can see, I forgot to bring this image. The kind of curvatures you can see, it is very horrible.
The child carries more than what is
more than what they are supposed to carry. Initially, when we were young, our books were packed up in a cupboard in school, but nowadays it seems they bring all to the house. Because they carry all back, and it's not helping.
Oh, okay. Now, mentioning this, it has to do with ergonomics, right? Yeah. So, can you discuss the role of ergonomic adjustment in the workplace or home to prevent low back pain, and even in our schools? Theo?
So ergonomics is very important, when it comes to posture and preventing musculoskeletal disorders. So when you come to our workplace, it depends on what your work entails. So when your work entails sitting a lot, that means you are always seated in your chair. So you have to pay attention to your chair. You have to get the right chair for yourself. So depending on your anthropology, like your stature, a short person, what will be good for a short person might be different for a tall person. As I'm sitting right now, I'm supposed to maintain a 1990 from my ankle to, but if you look at me, my ankle to my feet is not 90 because my feet are not touching the ground. Yeah. So I can say that I've not really adjusted this chair to my height also. So as workers, you have to adjust or get an adjustable seat. Some seats cannot be adjusted, so then you have no other option than to keep the awkward posture. When you get adjustable seats, you'll be able to adjust it to your size, to your height, and so forth, and so on and so forth. And also the people uses the screen, computers a lot. The computer should be at the eye level. If it's above or below, you're either going to bend or you're either going to raise your head, which is going to affect your back posture. And yeah, at home to our beds, the beds that we sleep on, it's best we get the orthopedic beds. But then if you can't afford it, I think we should get not so soft a mattress, but not so hard a mattress, so that when you sleep and you wake up, you will not have body pains or all those. So these are some of the ergonomic things. And also in schools too, I don't know how best the school can do this, because the desks, it's just, they're all the same, but the children come in different sizes. You have a tall children, a big child, or a short child, but they are all sitting or they are all using the same desk. So a desk can help be good for this child, but will be otherwise for that child. But I don't know how you can change that.
Nowadays, when you go to secondary school, they have a table and desk, not the mono desk. Okay. They're separate ones. I think they started developing. My time is drawing nearer, and you want to add something?
Yes, I wanted to add up to what my sister said. I think, yes, ergonomics is simply the relationship between you and your work or your environment, if I may say. So even the seat we are sitting on, I think it is ergonomically structured, because it supports your back, it gives you the right posture at your back. So setting up your working environment to suit the posture, the right posture that you need to assume at all times, is going to help you to prevent this back pain from attacking or affecting you. So one, your posture in sitting. As a mother in the house, you have to wash. How do I wash? With our old people, when you sit on a chair and watch, they tell you are lazy, but that is the right way. You have a seat with the backrest like this. You have a small chair or a table in front of you. You put your bowl on it. You have your washing bowl in front of you. Then you wash sitting upright.
Wow.
But most of the time, you see people bending over. Either they are not even sitting on a chair at all, bending over, or a short chair, and they bend over to wash. And you don't wash once in a year. At least every week you wash. So as you continue doing this for a long period of time, you go to people's office, they have their desks here, their laptop is somewhere here, their mouse is somewhere, and their screen is somewhere high. They always raise their head to see their screen. It doesn't help. You'll be assuming such postures for a long period of time, and in the long run, it will have effect on your spine.
All right. Like I said, my time is drawing nearer. Let's go to the treatment. What the emerging treatment of all these things? Then we'll wrap up.
With the treatment, as I said earlier, it's tailored according to your symptoms. But there are so many things. One, we talked about acute pain. When pain is acute, what we can use to bring down the pain is ice. One typical thing we can use is ice. So one, when you're having low back pain And if it's a short and maybe it happened yesterday, oh, yesterday I went to do these activities and I started feeling some pain at my back. You can just break some ice into a polythene bag or a rubber bag. You cover it with a towel. You can just wear the towel, place it at your back, but it shouldn't be more than 15 minutes.
Oh, okay.
Then you take it off. If you have any element, you can apply it. And some of the exercises we have taught, you can also do it. And one thing we can also resolve pain is rest. So we have something we call RICE, rest, ice, compression, and elevation. But with this, it's just pain. So you have to rest the place that you are feeling pain. So you rest, you apply the ice, the element, and you take a rest.
All right.
And you do some of the stretches we have talked about.
Your last word.
Okay, so our lower back is something that is very important that we have to be conscious of. Some people really do not care about it, and they'll still go back to how they do things. They'll still go back to how they lift things or how they sit in their workplaces. But mind you, low back or chronic low back or consistent low back can lead to more dangerous problems. Like, for example, a person with a spondylolisthesis that we showed, the one that a bone is slipped on the other, it can affect the spinal cord, the cord inside the vertebral bone. And when the spinal cord is affected, depending on where it happened, the organs or the body parts below that part will be affected. So if it's your lower limbs will be affected. Some people go to the extent that they are not able to walk or use their lower limbs anymore. So that's how important our low back is. And so when we tell you what to do, good posture, avoiding awkward posture, I think we have to be very mindful of it and very cautious of it, because it can lead to worse problems that you can ever imagine. Yeah, so that's what I have to say.
All right, Rich.
I will also say that, yes, our low back is very important as compared to all the organs in your body. So we should take good care of it, assume good posture, exercise, eat well, and have rest.
All right.
Needed.
Okay. Assume good posture, exercise, eat well, and have enough rest, and so on and so forth. This is where time will allow us to be with you. Richard Mensah is a physiotherapist from Cape Coast Teaching Hospital, and also Theodora Sewa Boachi Yadom, also physiotherapist from Cape Coast Teaching Hospital. Thanks so much for coming, and thank you for watching. Same time next week. God be with you.
Welcome.